suffering from open wounds, then you then what you do is you manage those other injuries. Like if there's another part of the body that is bleeding, you manage that bleeding, and so on and so forth. And if the person becomes unconscious, you place them on their side, let them lie on their side, so that they don't if any materials come from the alimentary canal, this may not shock them further. Now, if possible, remember what we talked about yesterday, you can conduct a CPR, cardiopulmonary resuscitation, if they are they are going into a state of unconsciousness. It's good that you perform a CPR if it is warranted, and if you find that it is fit to conduct a CPR so as to save this person's life. Okay. Ladies and gentlemen, it's now 1922. I don't know whether we should go into this group activity. Madam Rebecca, do you think we need to go into this group activity? I wanted us to get into this group activity and look at how we manage.
Maybe they could go through it and do it in the chats.
Okay, in the chats, yeah, in the chats. Then let's take about 5 minutes. In the meantime, I'll have Madam Rebecca preparing to come on board and handle the other types of injuries that we experience in our environment. Maybe you can go to the chats and indicate how you can tell that a bone is broken. Let's participate on the chats. How can you tell that the bone is broken? In very few words. With droning, one can use. Okay, yeah. Kinodia is saying that the bone protrudes. Yeah, the bone can. Yeah, the bone can break the. Let me have a large screen. The bone can break the skin and protrude. Swollen part. Or the person may be walking by limping. Abnormal movement. There is sweating. Yes. When one cannot walk. Okay, protruding bones if the rib is not able to support itself. Sweating. Okay, skin turns black. Okay, extreme pain. Yeah, extreme pain. One suffers extreme pain. The area becomes, well, sorry, a lot of pain at the point. Sweating, person will complain of pain, pale skin. That's true. It becomes swollen. Great. I can see that you are grasping. You have encountered broken bones in your various areas. Okay. And then let's ask ourselves, how do you manage a broken leg of a learner in a school environment? How would you manage it? In very few words, how would you manage a broken leg of a learner in a school? Maybe we can have one or two people airing their views. You can have your hand up. You can have your hand up. Others can write on the chat. How do you manage a broken leg of a learner in a school environment? Somebody? Yes, Akinyi? Unmute.
Yes, to manage a broken leg for a learner in an environment, you avoid any further movement. Then you put it in a position that you can help it to rest. You rest it a little bit, then you can help it with a sling. But you avoid the movement as much as possible.
Avoid movement as much as possible. That's great, Akinyi.
Okay, thank you.
Thank you. Philemon?
Yes, hello.
Yes, go ahead.
Yeah, I wanted to say similar to what she has just said, but maybe just say that it is called splinting. Yeah, you splint the wound. If the limb is broken, the bone is broken, you splint the limb. You can use some sticks, two pairs of sticks, and you can tie, like if it's the hand, you put the sticks on either sides of the hands, and then you tie with the cloth around to keep that bit straight.
Yes, yes.
Yeah, thank you.
Thank you, Philemon. That's great. That's great. The thing is, the rationale is you want to. I mean, the idea is you want to curtail further movement of that limb as much as possible. That's what Philemon is telling us in a nutshell. Yes, Lilo, Lilo, unmute.
Hello.
Yes, go ahead.
What I wanted to say actually has been said, so let me avoid repetition. Thank you.
Thank you for the elaboration. Florence, unmute Florence and speak. Okay, Florence amepotea. Okay, I can see on the chat people are very active. Salome Asheng Odor, don't release the reg, use something, use what? Use stretcher, or you meant a stretcher. Yeah, use a stretcher. Avoid any movement whatsoever. You can use a stretcher. You can even come up with one. You can make one, a makeshift one, so that you can be able to move the victim. And let's have someone share an experience they have had with a student suffering from a broken bone. How was that experience? Can someone give us an experience, and we hear from their experience what challenges they faced and what are the learnings that they acquired in that experience? Someone can give us, a good storyteller for that matter, someone who can explain to us an incident that occurred to themselves. Nani atuelezea? I know someone has suffered that predicament. Here you are. Esther Iraya. Esther, uko wapi? Unmute.
Okay, hello?
Yes, go ahead. I can hear you.
Good evening.
Good evening.
I had this harrowing experience. I must say, because not that I'm the panicky type, but this particular Saturday, actually it was on a Saturday, and we had the students now in. So at break time, I'm seated in the staff room, and the boys come running. So I can see their alarming, voices.
Yes.
So I rush out, and as I go to the field, I meet this boy. He's lying on the ground. His arm is broken, and there's a bone jutting out.
Wow.
I knew this was so serious. First of all, I'm thinking it's on a Saturday. And first of all, it's not exactly the right thing to be doing on a Saturday, because then they had told us we shouldn't have the lessons. So I decided I'm not going to panic. And to make it worse, the boys were actually trying to, put the bone in order.
Bone back.
And one told me, no, teacher, tunafanya hivi ndio asikufe. The boys in there, they are just children.
Yeah, sure.
So I told them to be very calm. We took the boy to the staff room. And the teacher who was supposed to help me, he's a man, had just gone out maybe for some tea or something. So I was there with the boys and trying to calm them. And I have no idea what I'm supposed to do. But I know I have to do something very great. So I put him down very calmly. He was really sweating. And he was in a lot of
conscious.
pain. Yes, he was conscious. So we put him, lay him down there in the staff room, and I didn't know what to do. So there was some piece of wood. I put it on one side, and I put another piece on the other side. Then I cut the curtain, and we tried to put his arm so that it doesn't move. And as he lay there, when the the man teacher came. So he told me, this is an emergency. We have to just go to hospital right away. So I told him, you take him to the hospital. You have him. Then I called by the time you guys go, I called the dad, because the dad was very alarmed. But the main thing I did was, one, calm everyone down, because, you know, can you imagine them trying to fix the bone so that he doesn't die? I think they had all panicked. It was really bad. So the main thing that I learned is that you must never panic. Must never panic, no matter how bad. First of all, there was also blood, a bit of blood. There was blood, and the bone was out. It was at the elbow, just here where you have the from the palm to the elbow, just before the elbow, the bone was out.
Was the bone broken, or the elbow bone had dislocated?
Not the bone. I'm telling you, the bone just before you get to the elbow, on the upper side of the hand, not under, not, I mean, on the upper side.
Yes.
The bone was broken. It was jutting out.
Okay, one of the two bones. You know, there are two bones there. One of the bones are broken and protruded.
Do you call it the femur? What is it called?
Whatever it is, but there are two. I know there are two.
Yes, one of them was jutting out. So it was possible to put one piece of wood on one side, another one, to make the hand very, doesn't move anymore.
Wow.
And because it was bleeding, so we had to make it an emergency. So we didn't do much, just making the hand very still and rushing him to hospital. But I still remember that experience as one of the most challenging experiences that I have had as far as emergencies and bleeding and fractures is concerned.
Wow. Thank you, Marim. Thank you, Teacher Ira, for that experience that you have shared. We are told by Omondi Oro that those bones are called ulna and radius. Exactly, they are called ulna and radius. I think one of them, the larger one, is the radius or something, or the larger one or the smaller one. But one of them was broken anyway. One of them was broken. Now, we could share, and I don't want to eat into Madam Rebecca's presentation. Elizabeth, Akinyi, and company, please allow me to usher in Madam Rebecca. Let's learn from what Marim Esther has told us about managing a crisis. Stay calm. No matter how excitable you are, stay calm. And it's good to be equipped with knowledge. Have a knowledge on basic first aid. And I like the way you responded to that emergency. You took the curtains, you didn't worry about the cost of the curtains, and you first of all secured the victim before you could move to anything else. Plus, you're also a good narrator. You could take to writing. You can write very nice stories, Madam Iraya. Thank you so much. Let us usher in Madam Rebecca to take us through the next part of the presentation. I'm sorry, Madam Rebecca, for eating into so much time. I believe you'll have enough time to catch up on what is remaining in our presentation. Let me pull down the screen so that you can pull up your part of the presentation. Madam Rebecca, you're with us?
Okay, thank you, Mr. Gatti, for that wonderful presentation. Let's appreciate him in the chat. And I have really enjoyed the presentation.
Thank you.
Also the experiences, especially the last by Esther Iraya.
Yes.
Okay, that is good sharing the experiences. We are learning from one another. And I would wish to continue from where Mr. Gatti has stopped. Maybe Simon Kimani, your hand is still up. Maybe you have something that is very burning. You could unmute. I hope.
Madam Rebecca, you can do a screenshot.
Okay.
A slideshow. Do a slideshow.
So Simon Kimani,
It is
do you
okay,
want
we
to
can
say
continue.
something?
You can continue.
Okay.
Let us continue.
Okay. Let's continue so that we finish on time. So you have had that experience that Esther Iraya went through with the runners. So we realized that in our schools, runners get injured on the playgrounds. Other times, the school buses are involved in accidents. Other times in laboratories, also in the kitchen. So it is our responsibility that we ensure that we safeguard their safety as much as possible. But then we also need to be prepared so that we are able to know how we are to handle or manage those casualties who might get injured in the school. So I wish to take you through the other part on managing injuries, and we will look at the broken bones, as you have heard from Esther that it happens. And broken bones are referred to as fractures in the medical terms. And we have various types of bone fractures. We have the closed or open fractures. Again, we have complete fractures, displaced fractures, partial fractures, stress fractures. All these are different types of fractures. And the one that Esther described, it seems it was an open fracture. So an open fracture, a fracture is referred to as closed if the injury doesn't break open the skin. But when if the skin does open, it's called an open fracture. And then we have the complete fractures, whereby the break goes completely through the bone and it separates it into two. Then we might have displaced fractures where a gap forms where the bone breaks. And we find that most of the time, the displaced fractures requires an operation so as to fix the bone. Then we have the partial fracture, whereby the break doesn't go all the way through the bone. Then we have the stress fracture, whereby the bone gets cracked. We have various causes of broken bones, as we have heard Esther explaining. Maybe he could have explained further what happened to the boy. But we find that bones are very strong, but sometimes they break. Maybe sometimes when they can result as a result of a repetitive force being applied on the bone. And for example, when there is a car crash, or when the boys are playing in the field, or the girls, or it can result as a result of a fall, as the students are running, maybe they fall. Other times it may happen when they fall on top of buildings. Sometimes the bones may break. So some of the symptoms of bone fractures include pain. Sometimes they may experience a very intense pain. And again, there might be inflammation, that is swelling. Again, there might be bruising. Sometimes you might find the skin is discolored. Sometimes you might find unusual curvature. That is, if it is the leg, it is not straight, there are some curvatures. Sometimes you might find the patient cannot move the affected area. Even if you ask them to move the affected area, they are unable to move them. And sometimes the patient may feel abrasions at the site of the injured bone. And in case of the open fracture, there may be bleeding. And so we find that we need to prepare ourselves or to learn how to give first aid in the case of such. And the first aid that we can offer for broken bones, if, for example, it is an open fracture, we require to cover the wound, and we do cover it with a sterile dressing so that we do not even infect the injured part. For example, if it is open, again, we need to apply pressure around the wound, but we should not apply pressure on the protruding bone. So we place padding around the injury for extra support. You remember the explanation that we were given by Esther. So you try to support the injured part to avoid further injury. So once you've done this, you need to report to the head of the institution. It was unfortunate then that Esther, it was on a weekend, but I believe you reported wherever the head of the institution was required to know. But in circumstances where the head of the institution is not in, then you need to take charge so that you save the life. So again, you are not supposed to move the casualty until you have secured that injured part. And if necessary, you are reassure that person that he will get well. That is not the time to worry them that, for example, if they were in the field praying, first of all is to calm them, ensure that you calm everybody so that you are able to assist. You are not supposed to raise the leg if you suspect that it has been broken. Then you monitor until help arrives. Other times you might find that the pelvis or the ribs are injured. And a pelvis fracture is a break in any bone at the hip level. And we have various types of pelvic fractures. We have the stable ones, the stable fracture. We have the unstable fracture. And the stable fracture, the broken bones are still properly lined up, and therefore the ring has kept its shape. So usually only one bone is affected, and mostly it usually has just a single fracture. Then unstable fracture occurs when there are two or more breaks in the pelvic ring and ends of the broken bones. They move apart. And this most likely it happens especially when an individual is involved in an accident. It has ever happened. And it involves more bleeding than in stable fractures, because we find that there is a separation of the broken bones. And this separation is the one that allows blood to move freely. And causes of the pelvic fracture, we are saying that they are caused by major trauma such as road accidents. And the less severe ones involves displacement of the hips as a result of one falling. You may trip, for example. Some people trip in the bathroom and they get injured. Sometimes around the hip, causing these less severe fractures, and they are usually very painful. So it is also good to know how to manage them. And we find that those less severe also may have may also be visible. There may be visible signs of bleeding. So some of the visible or some of the signs and symptoms of the pelvic fractures include pain, and also you might feel tenderness around the groin, around the hip, also the lower back, and also around the buttocks or the pelvis. Then there might be bruising, and also there might be swelling over the pelvic bones. And again, you might feel numb or tingling in the around the genital areas and also the upper part of the thighs. And when sitting, one may feel pain, and even while using the toilet, you might also feel the pain. And we have first aid that we can offer to those people with pelvic fractures. That is before help arrives, because we know that such injuries require further attention. So before help arrives, if you suspect that somebody has a pelvic fracture, that person should be covered with a blanket and should not move. Should not be moved by an untrained personnel, because this might be they might cause severe injuries, and sometimes such injuries might be reversible, because we find that it can even cause somebody to be paralyzed for life. So it is good that we avoid moving such victims. We wait for trained personnel to assist. Maybe we could call an ambulance or such. If you are at a road accident scene, for example, and you realize that a person is walking, because sometimes even due to shock, they might not even be feeling the pain at that particular time. Get them to get still and to sit down so that they do not get further injuries. And then you interrogate whether they have further pain. If they have chest pain, they have abdominal pain, pain in the hips, so that you are able to determine whether they might be having that pelvic fracture. And always, if you should assume they are seriously injured and keep them still, you keep them warm until emergency services arrive. In case we have debris, I was listening to your discussions when you had gone for the breakout rooms, and someone mentioned that when somebody is injured, you have loose debris in the body, you should remove them. Yes, you should remove them. Foreign particles from the wood should be removed. But if they are large, such as knives, arrows, weapons, you should not remove them. Because if you remove them, then you can cause further harm to the injured person. So because if you remove them, then also bleeding might increase. They might lose blood to death. So in case of such, you bandage that victim and the object still in their bodies, you bandage around it, and then you ensure that they are attended to. So again, you need to put pressure on the wood so that you avoid much bleeding. You use a clean cloth. You can use a bandage or a piece of cloth. And if you don't have those things around, you can use your hand. And maybe if you have some gloves, you can put them on, because we have some infectious diseases that you could maybe contract. So you ensure that you maintain medium pressure on the wound so that you stop or you slow the bleeding. And then you organize on how the patient will be taken to hospital. Then we have other injuries, such as soft tissue injuries. And these soft tissue injuries are, for example, as a result of trauma to the skin, also to the muscles, the tendons or the ligaments in the body. And these are not fractures. But we also need to know how to manage them, because also our runners sometimes get those soft tissue injuries. Many activities can lead to soft tissue damages of the muscles, of the ligaments, and even the tendons. And when the soft tissues are injured, the individual may feel a lot of pain. They may swell. You may see bruises and even some damages to the skin. So we have various types of soft tissue injuries. The first one is known as contusion or bruises. And this one is the injury to the soft tissue. And it is often produced by a blunt force. For example, a kick, a fall, or a blow. So this might cause a lot of pain. It may lead to swelling and even discoloration, because some blood may clot on the tissue, so causing the discoloration of the skin. And the treatment for contusion or these bruises is use of the rice. The rice, I had somebody explain it so well in the breakout rooms. That is, you make the individual to rest, apply some ice. You can also do some compression, and then you elevate the part that has been injured. But we find that those who have been seriously injured with serious contusions may need to be seen by the doctor. So you can take them to hospital if they are seriously injured. Again, we have a sprain. And a sprain is a partial tear to the ligament, and is often caused by, for example, a twist. The leg may twist and then cause a sprain. And mostly some of the parts of the body that may sprain are the ankles, the knees, or the wrist, those places with the joints. The treatment for sprain include the same as the one for contusion. That is, you apply RICE, R-I-C-E. That is R for rest, I for ice, C for compression, and then elevation. So in case the ligament is completely torn, therefore we will require surgical repair. We need to take the patient to hospital. And mostly ankle sprain is most common also in our schools, and it is very painful. And we find that this sprain usually occurs as a result of a sudden twisting, turning, or, for example, rolling movements. Then we have tendonitis. Tendonitis is the inflammation of the tendons. We have tendons in the joints, and a tendon is a flexible band of tissue. It connects the muscles to the bones. And these tendonitis usually occur as a result of overuse, an overuse injury in the affected area. This is as a result of repetitive motion. And mostly, again, the most commonly affected areas include the elbow, the hand, the wrist, the shoulder, the hip, the knees, and also the ankle and the foot. Those places where we have the joints. Then we have bursitis. And also this is the inflammation of the bursa. The bursa is a fluid which is filled. It is a fluid-filled sac. And this sac provides cushion between the bones and the muscles or the tendons. And we find that this bursitis, like the tendonitis, it is caused by overuse injury. although it can also be caused by direct trauma to the joint. If there is a lot of trauma in the joints, then this tendonitis can also, this bursitis can also occur. But we find that they also affect the shoulder, the elbow, the knee, the hip, the ankle, and also the foot. The other type of injury that is common is stress injuries, a stress fracture, which is a small crack in a bone. And this one is usually, it occurs as a result of, or it occurs on, for example, weight-bearing bones. That is along the, for example, on the legs, on the hips, and also on the feet. And again, they are also caused as a result of overuse. And when you increase in physical activity, for example, when the students are participating in athletics, sometimes it may occur. Then a strain is an injury to a muscle or tendon. Also, again, it is caused by overuse. Or again, you strain the muscles as you stretch. Strenuous exercise may cause this. And the treatment for strain is to rest. You rest those muscles. You apply ice compression and elevation, the one that we are calling RICE. So if a tear is in the muscle, if a tear occurs in the muscles, then it needs to be repaired surgically. There must be surgery has to be done so as to repair. So in case the strain, there is the strain and then the muscles tear, then you have to take that runner to hospital for some surgery to be done, and then treatment will be done. Then we have the nose bleeding. I also heard somebody talk about nose bleeding when you are in the breakout rooms, and it was very well explained. So nose bleeding is also known as epistaxis. And we find that it is a very common, nose bleeding is very common, and most like 60% of the people usually experience nose bleeding in their lifetime. I don't know whether even us as teachers, we have had some time where we have experienced this. And we therefore need to know how to manage somebody who is nose bleeding. So we find that the nose is in the middle of the face, and therefore it is the first place which mostly can get injured. For example, we have various types of nose bleeding. We have the anterior nose bleeding, and then we have the posterior nose bleeding. I will not explain on this because you will read about it, but we know that nose bleeding happens amongst our students. And the most common cause of nose bleeding is dry air. Dry air can be caused by, for example, hot or humid climate or heated indoor air. So what happens is that due to this, the nose dries up, then there are cracks in the nose, and then in case you rub the nose, or you pick or you blow the nose, then the bleeding may start. Other common causes of nose bleeding are, for example, cold weather. Cold weather may cause some individuals to nose breathe. Then again, blowing your nose with a lot of force, and again inserting an object into the nose, and also allergies. Some runners might be having conditions like rhinitis. Then again, in case somebody is using blood thinning drugs, it might cause nose bleeding. And sometimes in case somebody, not the runners, somebody might be using other drugs that are inhaled through the nose, they might cause nose bleeding. And we know we have been giving some first aid when we have our runners experience nose bleeding. The first aid that we should offer to our runners when they are nose bleeding is to make them relax. Also ensure that we ensure that they sit upright and their bodies to lean forward. Their heads should be slightly leaning forward. And maybe we could request them to breathe through their mouth. And again, one can use a tissue or even a damp cloth to catch the blood that is maybe escaping from the nose. Then what you do, you use your thumb and then the index finger to pinch the nose together. That is the soft part of the nose. Then one should squeeze at or above the bony part of the nose so as to put pressure, and this will help to stop the bleeding. And this should be done continuously for at least 5 minutes before checking whether the bleeding has stopped. But again, if the bleeding does not stop, then you have continued squeezing for another 10 minutes. Then you can apply ice pack to that bridge of the nose so that you further constrict the blood vessels. And if the bleeding does not stop, then we know we should take the patient to the hospital. So the bleeding should stop after, before, if you cannot stop that bleeding after more than 15 to 20 minutes of doing all that, then we should try and seek further attention. We know this bleeding can lead to a lot of blood loss, and maybe you could find that the runner or the patient might be experiencing difficulties in breathing. Sometimes you might find them vomiting blood, which maybe they could have swallowed, and they need to be checked. But we find that we have been using various ways of, due to lack of information, we find that some of our patients, we used to tell them to lie on their back. I believe now you have known that they are not supposed to lie on their back as we used to do. Sometimes even in our time when we were schooling, we used to be told to lie on our backs. Now we are realizing that that is not the way it should be. The other type of injury is burns, and burns are very common. And a burn is an injury to the skin and or other tissues caused by heat. It can also be as a result of radiation, radioactivity, also electricity, again, also friction and even contact with chemicals. So these are some of the causes of burns. And we have 4 types of burns. We have the 1st-degree burns, we have the 2nd-degree burns, the 3rd-degree burns, and the 4th-degree burns. The 1st-degree burns, and these ones affect only the outer area of the skin. They are mild ones. Then we have the 2nd-degree burns, whereby the outer area of the skin and the one that is underneath has also been damaged. And so only part of your damage is damaged. Then we have the 3rd-degree burns. And this one, sometimes also it is referred to as full thickness burn. And this type of injury destroys 2 full layers of your skin. And it is the deepest and most severe burn. Then we have the 4th-degree burn. These types of burns destroys all layers of your skin. And it might even destroy the bones and the tendons. The common causes of burns, we have said that can be as a result of fire. And this could be open flames. And open flames are most common causes of burns. But we also have friction burns, whereby when a hard object rubs off some of your skin. Then we have cold burns. We have thermal burns, radiation burns, chemical burns that are caused by, for example, acids, detergents. Then we have the electrical burns, whereby one might get burns as a result of coming into contact with electricity, live wires. And we have the first aid for burns. And when you realize that somebody has been burned, for example, serious burns, you need to call an ambulance, or you seek emergency medical care. And you need to, for example, follow the following steps before the emergency arrives. Because I heard somebody asked, what happens if somebody has been burned and there is nowhere that you can be able to, for example, hold? So for such a case, you ensure that you call for help. You can ask for an ambulance or seek medical care that person to be attended from wherever the burn occurred. So make sure you and the person who's burned are safe. So in case it was a fire that occurred in the school, there was a fire in the dorm, and maybe the pupils got some burns. Make sure you and the runners, you are safe and you are out of that harm. Then you move them away from the source of the fire or the burn. And if it is electrical burn, ensure that you put off the power source before touching them, because you might also be in danger. And then after you have placed them in a safe place, you check to see if they are breathing. And then if needed, if you need to resuscitate them, then you do it. Then again, you ensure that you remove restrictive items from their bodies. If they have a belt, you loosen it. If they have some jewelry and it is possible to remove them, you can remove them from the burnt areas. Because we find that after one has had some burns, those parts that are burnt swells. So it is important that you remove those jewelry or whatever that is around the burnt area as fast as possible. Then you cover the burnt area. You use a clean cloth, and you can even bandage. You cover it with a cool, you moisten that bandage with cool, clean water. Again, If it is around the fingers, you ensure that you separate them. If it is around the feet, you ensure you separate the toes because they might stick to one another, and even to remove them might be very painful. So you ensure you separate the fingers. If it is the toes, you separate them with the dry and sterile non-adhesive bandages, which cannot stick on the wood. Again, you can, if possible, you can remove the clothing from the band area. But if the clothes are stuck on the body, on the skin, don't try pulling them because you might pull even the flesh. So it is good that you leave them intact and then you wait for the medics to do that. Avoid immersing the person or the burned body parts in water. You should avoid immersing those body parts in the water. You can also raise the band area. You elevate the band area above their heart, and maybe this could help. And again, you try to reassure those people who have experienced that. So you calm them and reassure them that help is on the way and they will be better. So again, there are some things that you should ensure that you do not do. You are not supposed to start offering first aid before you ensure your own safety. So first of all, you need to ensure that you are safe before you start administering a first aid. Just as we have said, if, for example, the victim, you have rescued the victim from a burning dome, you should first of all ensure that you are also safe. Otherwise, the two of you might become casualties. Again, you are not supposed to apply paste, oil, turmeric, or cotton to the burn. I have seen in the charts people saying that you're supposed to apply some ointment. It is good that you do not apply the ones that are specified. Do not apply eyes on burns because it might deepen the injury. Again, you should avoid prolonged cooling with water because it leads to hypothermia. And again, do not open blisters. Sometimes we find that after burns, we try to open those blisters. They are not supposed to be open until topical antiseptic has been applied. And then again, you are not supposed to apply material directly to the wound because this might even infect the woods and they might become even much more serious. So we are supposed not to apply a topical medication until that patient has been seen by a medical doctor and the right prescription has been given. So with those very many remarks, I wish to stop there and maybe we go to the group processing. Maybe on the charts, I want you to think about one thing that you learned, or maybe you can raise your hand. You tell us one thing that you have learned, and when you went for breakout rooms, what you contributed to the group, so that maybe we hear a few of you responding. And others, maybe you could respond on the charts. Akinyi Mary. Let's have Akinyi Mary followed by Dorothy. And then Faustine.
Yeah, Rebecca, first I want to ask a question before I go to one thing that I've learned.
Yes.
What is your take when some people say that maybe a band, they can just use a urine? What is your take on that? I know some people talk of using a urine or aloe vera. What is your take on that?
Okay. Any other question? Okay, I don't know whether it is medically proven that urine can be able to heal. What I know is that you're not supposed to apply any ointment or paste. Let's hear from Gatia. Gatia, are you still on board? But
Yes,
according,
Rebecca.
yes,
Rebecca.
what do you think about use of urine on the bands?
Sorry?
Use of urine on the bands?
Well, there are some communities that do that. You know, urine has an antiseptic effect. Some communities even use it to clean the udder of the cow as they milk. They use urine. In fact, urine has been used. There is what we call urine therapy. Urine has antiseptic nature in itself, and again, it also has it can kill some microbes. So it can be applied, yes, but then this has come out of traditional medicine, and not all traditional medicine works 100%, because as we are aware, the same urine has bits of microorganisms that can infect a burn. So I would opt for better remedy than the use of urine, because it is not conventional way of treating a burn.
Okay, thank you, Mr. Gatia, for that contribution. I hope
thank you. So yeah, I'm satisfied. So one thing I've learned today, I've learned about the degree of burns, and more explanation into that has been very helpful.
Okay.
And one thing I contributed in my group is giving a report as a secretary and encouraging member to actively participate in the group. Thank you.
Okay, thank you, Mary. We could have Faustin Makaranya. Are you on board? You want to say something? If you want a clarification or you want to contribute what you learned, what you contributed to the group. You are taking too much time. Sister Rachel. Sister Rachel, you can unmute.
Hello.
Hello.
Yes, so I am glad that I have been in the session. I was able to contribute in the group breakouts as a chair. But at the same time, I have learned a lot, especially on the different injuries and how to take care of them. I did appreciate, especially on fractures, because these are sometimes very scary. You just don't know how to do it. As one teacher shared on her experience, it is really scary. But all the same, now I have some confidence on approaching any of these injuries that we've learned this evening. And I feel that I have all the guts to at least be of help to any situation that comes along. Thank you.
Okay, thank you, sister, for that. And to hear that you have learned a lot, you have always been very active. Then Monica Jega. Monica. Monica, unmute. Maybe you're not unmuting, you're taking too long.
What I'm saying is,
Okay.
hello?
Hello.
Yes, I had asked a question in the chat because I
Okay.
needed to know why we raise the band part above the heart. Why do we raise the band part above the heart?
Maybe I would want to answer that.
Mm-hmm.
You know, when the band, when you lower the affected part of the body, like if it, for example, if it was if it's the heart, for instance, or the foot, you don't expose that part of the body to a lot of heart pressure. You know, heart pressure in us, you know, the pumping of the heart is not as much as if that particular part of the body was below the heart level. So what this is meant to do is to reduce the pain to the victim. So the casualty does not, the heart does not exert a lot of pressure on that part of the body that has been that has been burnt. So the pain, there's strict reduction of the amount of pain that the victim experiences.
Thank you, thank you. I have also learned about the different fractures and the different injuries and how to give first aid on them.
Okay, thank you, Monica, to hear that you have benefited from that. Then, do we have Peter on board? Peter?
Yes. Good evening.
Good evening.
Yes, I'm sorry, first of all, that I came in a bit late, but I got people discussing what they were doing in the rooms. But later on, I've learned about offering the first aid, particularly to the injuries, by the use of an acronym of RISE. This is really, I really feel good after learning about it. I've never heard about it, but today I've learned about it. Perhaps maybe what I could ask on the burns, what about when maybe people get burned by use of water? I think we call them, I don't know whether it's scalds or something like that. Do we also handle them the way that we handle the other burns? Thank you.
Okay, what I know is that mostly when one is burned by, for example, one gets the scalds. Again, we have been told that we should not break them, but maybe we could, for example, take them to hospital and then maybe given the right treatment. Unless Mr. Gatia, you could add something.
Basically, when you have a scald and there is a blister that has developed, you keep the blister intact until you get to a medical practitioner who may pierce the blister and apply an antiseptic. Otherwise, it's good that you let the blister be. But if the skin comes off, what you need to do is just to keep that wound very clean. If you have access to a gauze that has an antiseptic cream on it, then you can apply on the scalded area. Otherwise, you are supposed to let the wound remain as clean as possible and ferry the person to a medical personnel who removes the dead tissues and washes the wound and then applies an antiseptic and bandages the wound so as to secure it from microorganisms. That's the best that you can do.
Thank you so much.
Okay, thank you so much, Mr. Gatia. Maybe I could read a few comments on the chat and then we close. This one who has said that they have run on first aid on nose bleeding, how you're supposed to lean forward. Exactly. I have learned about internal and external bleeding and how to give first aid. I have learned what not to do or to be courteous when handling a burn wood. I've learned a lot about obstruction and the different types. Quite educative, as many times young runners have given teachers. Frights, I have learned how to give first aid to nose bleeding. I've learned on types of air obstruction, and then types of injuries and how to manage them. I've learned about types of soft tissue injuries. So I would like to thank all of you, and mostly those who were very active in the discussion. And maybe I will give Anne Mwangi a chance to maybe make a comment and pray, so that we break and then we meet tomorrow as we conclude the training. Welcome, Anne Mwangi. Yes.
Before Madam Mwangi comes on board, I want to follow up on Madam Esther Iraya's case. She commented somewhere on the chat that the boy who got a broken bone on his arm eventually came back to school after staying in hospital for 1 month. He stayed in hospital for 1 month, and then eventually he came back to school after 1 term, meaning the fracture was serious. And they later discovered that the boy suffered from bone fragility. Now, bone fragility is a case where the bones are brittle. They are very easy to break. For example, people who live in areas where their water contains a lot of chlorine, for instance, a place like Naivasha, where I lived for some time, you find that they develop, if you are born in such an area, you develop brittle bones. And these individuals have also brown teeth, and the brown teeth indicates even how their bones are actually, how their bone formation is. So the bones become very brittle, and children in such schools are discouraged from having very aggressive games as such, like rugby, for instance, or football, because they can easily suffer from fractures. So I think that is the case that Esther experienced in her school, and that should inform us as teachers that depending on where we are working, we need to be conversant with some of the contextual problems that we might encounter in terms of injuries that our children might experience in the course of their learning. Thank you so much.
Okay, thank you, Mr. Gatia, for that input. And Mwangi, unmute yourself.
Good evening.
Good evening.
Good evening.
Thank you so much. We have learned a lot, and we thank you, our facilitators. And it's only the question also I hand just to understand why someone happened to faint. She was unconscious, and others came to pat under the foot. I didn't understand that logic, so I decided to understand if it has a meaning in this unconsciousness or the fainting.
I didn't get you, Madam Mwangi. That they faint.
One lady happened to faint, and when the others came to give the first aid, they started to pat under the foot when the lady is lying down.
Under the foot.
Yeah.
Could be, maybe they were trying to see whether he's conscious or unconscious.
Under the feet, the feet and the palms are they are regions where we have nerve endings, and therefore you can stimulate one into consciousness by patting their palms and also the sole of their feet. I'm sure even now, if someone scratched you at the sole of your feet, you'll feel some sensitivity because you have a lot of nerve endings on the sole of your feet. Maybe that could be the reason. And again, this is contextual. This is cultural medicine also. I should think so. Yeah.
Thank you. We pray. In the name of the Father, Son, and the Holy Spirit. Amen. We thank you, Lord, for the gift of this evening, this day, for the gift of our facilitators and we colleagues, that you have given us ample time, and you have given us the graces that each one of us is in most need of in order to accomplish this mission of whatever that we are learning, so that we may acquire knowledge in order to handle the young ones and all those that you have called us to serve in different ways in our institutions and in the society. We pray for our facilitators that you may grant them more strength and the whole ministry, that in order for everything also they are planning to instill in us, so that we may do well in the field. May God be working with them each and every day. We pray this through Christ our Lord. Amen.
Amen.
In the name of the Father, Son, and the Holy Spirit. Amen.
Thank you. Thank
Good
you.
night.
I want to thank all of you on behalf of my co-facilitators, Madam Rebecca, Madam Mugambi, and Dr. Christine. We wish you well. You have earned your supper. Have a good evening.
Good evening to you all. We meet tomorrow for the last session.
Okay.
Is it possible to post the slides on the wall? Bye.
Bye.
Good night.
Good night.
God bless you.
Bye. Good night. Bye.
Bye.